So let's jump right into this explainer. Imagine your body is this massive, bustling highway network. Trillions of your cells are relying on a constant 24/7 supply of oxygen just to survive. But what happens if a genetic glitch totally shuts down the very factory that builds your oxygen delivery truck?
Well, today we are unpacking the fascinating, high-stakes science of thalassemia. It's a really complex blood disorder. And get this, it's actually shaped by an incredible evolutionary tug-of-war, where carrying this genetic glitch somehow protected our ancestors from malaria. It's literally one of the most common genetic disorders in the world, affecting millions of families. And to truly grasp the massive human toll here, we need to trace its path from a microscopic typo in our DNA all the way up to its profound impact on human destiny. Here's how we're going to break it all down today. We'll start at the microscopic level with the oxygen delivery crisis, compare the alpha and beta genetic roots, look at the toll it takes on the body, solve the diagnostic puzzle, talk about managing the iron threat, and finally wrap up with the groundbreaking CRISPR cure. All right, part 1, the oxygen delivery crisis. Let's figure out what exactly goes wrong at the cellular level. So thalassemia is what we call an inherited autosomal recessive blood disorder. That basically just means you need to inherit a faulty gene from both parents to get the severe form of the disease. It's defined by a synthesis deficiency in the globin chains that make up human hemoglobin. Look at it this way. If hemoglobin is the oxygen delivery truck for your cells, thalassemia is a fundamental error in the factory's blueprint. The body simply cannot manufacture the right parts, leaving your blood completely without the vital proteins it needs to transport oxygen. Moving right along to part 2, genetic roots, alpha versus beta. Healthy adult hemoglobin is a perfectly balanced machine. It needs exactly 2 alpha parts and 2 beta parts to work. But it's super interesting to see the fundamental difference in how these two pathways actually break down. Alpha thalassemia is caused by large deletional mutations on chromosome 16. We're talking entire genes just going missing. Beta thalassemia, on the other hand, is driven by over 300 distinct point mutations, just tiny microscopic typos on chromosome 11. The severity of alpha thalassemia scales almost exactly like a staircase, directly based on how many of your 4 alpha genes got deleted. Missing just 1? You're a silent carrier. You wouldn't even know you had it. Miss 2? You've got a mild trait. But at 3 deletions, things get really serious. That causes hemoglobin H disease, leading to moderate to severe anemia. And tragically, if all 4 are missing, a condition known as hemoglobin Bart's, the baby's blood holds onto oxygen so tightly it outright refuses to release it to the tissues. This almost always culminates in fatal consequences before or shortly after birth. Now, on the flip side, we have beta thalassemia. In this scenario, your body is still churning out alpha parts, but it's completely stopped, or at least severely reduced, making the beta parts. And you know what? It's actually those leftover, unpaired alpha parts piling up on the factory floor that do the real damage. They are incredibly unstable. They clump together inside the developing red blood cells right there in the bone marrow. This causes massive oxidative damage, literally destroying the cells from the inside out before they ever even hit your bloodstream. Doctors call this ineffective erythropoiesis. Okay, part 3, the toll on the body. Let's look at how this microscopic breakdown wreaks havoc on a macro scale. When a baby is born, they're relying on fetal hemoglobin, which cleverly doesn't even use those faulty beta chains. But right around 2 years old, that fetal hemoglobin naturally tapers off. Suddenly, the body is starved of oxygen, a state known as chronic cellular hypoxia. The body's emergency alarms are absolutely blaring. It pumps out massive amounts of erythropoietin to force the bone marrow into overdrive, and the marrow expands so violently that it physically alters the skeletal structure. It pushes the bones of the skull and face outward, causing frontal bossing and creates this crazy hair-on-end look on x-rays. Meanwhile, organs like the spleen and liver massively swell up because they're working overtime trying to filter out a constant stream of broken red blood cells. Next up, part 4, solving the diagnostic puzzle. How do doctors intercept this cascading crisis? It's basically a logical sequence of detective work. Step 1 is a simple complete blood count, or CBC, which flags microcytic anemia, meaning the red blood cells are abnormally tiny and pale. Step 2, they run a specialized sorting test like an HPLC, or hemoglobin electrophoresis. This is a game changer because it actually measures the different types of hemoglobin in the blood. If adult hemoglobin is completely MIA, but fetal hemoglobin is sky high, you know for sure you're looking at a major thalassemia case. Finally, in step 3, they use advanced DNA sequencing to hunt down the exact molecular typo on the chromosomes to lock in a definitive diagnosis. Moving to part 5, managing the iron threat.
This is where things get really tricky for patients.
For severe thalassemia, the standard treatment is lifelong, scheduled red blood cell transfusions every 2 to 4 weeks. It is absolutely a lifesaver. It keeps their oxygen levels up and shuts down that terrifying bone marrow expansion we just talked about. But there is a major catch. It introduces a massive, deadly new threat: toxic iron buildup. Every single drop of transfused blood is packed with iron, and the human body literally has no active mechanism to excrete the excess. So over time, the cure slowly morphs into a poison.
So the absolutely crucial number doctors watch is 1,000 nanograms per milliliter. They monitor a protein called serum ferritin, and the second a patient crosses that 1,000 threshold, they have to take action. The patient immediately starts iron chelation therapy, taking specialized medications that chemically bind to the free-floating heavy metal in their blood so the body can finally flush it out. And why is monitoring that specific number so incredibly important? Because without chelation, that heavy, toxic iron gets super aggressive. It deposits directly into vital organs. It settles in the liver, leading to progressive cirrhosis. It attacks the endocrine system, triggering diabetes and stunting growth. But the absolute worst part, it builds up in the heart, causing severe arrhythmias and heart failure. In fact, heart failure is tragically the leading cause of death for transfusion-dependent patients. Finally, part 6, the CRISPR cure. This is where the story gets incredibly hopeful. Historically, the only real cure out there was a bone marrow transplant. If you were lucky enough to find a perfectly matched sibling donor, the success rate is an amazing 80 to 90%. But finding that perfect match, it is incredibly rare. So for everyone else lacking a donor, scientists turned to gene therapy. And they uncovered the ultimate biological plot twist. Enter the CRISPR-Cas9 hack. This is honestly mind-blowing. Scientists take the patient's own stem cells out of their body, but instead of even trying to fix the broken adult beta gene, they use CRISPR to target a specific molecular switch in the DNA called the BC11A erythroid enhancer. They literally edit the DNA to snip the switch out. And guess what happens? It tricks the body into turning its fetal hemoglobin, the stuff you naturally stopped making as a toddler, right back on. It completely bypasses the broken adult blueprint and perfectly compensates for the disease. This is a massive, massive triumph. Because doctors are using the patient's own cells, there is absolutely zero risk of graft versus host disease. You take their cells, you flip a genetic switch to fix the factory, and you put them back in. The result? It renders these patients completely transfusion-free. It gives them back a normal, healthy life. It really leaves us with such an inspiring thought about the future of medicine. A disease that evolution tied so closely to our ancient human history is now being conquered by our ability to edit the very code of life itself. Now that we can rewrite the genetic code to conquer thalassemia, which ancient disease will CRISPR cure next? I really hope this explainer helped you grasp the profound journey from defective DNA to these breathtaking new cures. Thanks for hanging out and exploring our genetic future with me today.